My name is Ivy, and today we're going to discuss the components of our CS system. Our CS system is actually designed to be a Class 2, Class 3 malocclusion corrector. The components that are included in our CS system is a pivot, a screw, and a CS5 spring. So throughout our development of the CS system, we have made some improvements. Some of the first improvements that we have made is a variety of pivots. The first pivot that we have is actually what is called the twist lock. So this actually gets attached onto the arch wire. You twist it and it locks onto the arch wire itself. Another pivot that we have available is actually called our self-ligating pivot. As you can see, this will actually have a locking door very similar to a self-ligating bracket that will then attach to the arch wire. We also have what's called our traditional pivot. As you can see here, there is an arch wire slot that can fit on either an 0-8 or an 0-22 slot size. As far as our twist lock and our self-ligating pivots, those are designed for an 0-22 slot size. What I wanted to emphasize with our CS system, again, you can utilize this as a Class 2 or Class 3 corrector. In using the system as a whole, using all three parts that I had just described, we are going to gain anywhere from about a 1/2 to 3/4 millimeter movement every 4 weeks. What that means is in anywhere from 4 to 5 months, we could have up to 5 millimeters of movement. That's fantastic. A lot of times it will take up to 8 months of elastic wear, that's if the patient is compliant, to gain that much movement. So again, this is better than our elastic wear. It can cut the elastic wear in half. With our CS system, now that I've shown you all the pivots, you can see that these simply get attached onto the arch wire itself. That means no measurement, that means no having to add adhesive, keeps it very simple. The last part is saving chair time. The great thing about this, and I'm going to demo here shortly for you, is that we can pre-assemble both our self-ligating and our twist lock pivot. We can also do that with our traditional pivot. So I'm going to take some time and show you how you can prepare this in your office to save chair time. All right, so another improvement we made on our CS5 spring was actually adding a wider circumference to the eyelid itself, so that would gain more mobility and patient comfort. Another feature that we added an improvement on is edges of the spring itself. We rounded those out, made them a little bit softer, also for patient comfort. Now with these CS springs, the nice thing is they come in both a 7mm and a 10mm spring, so no measuring. You can choose which one will work best for you. We have found that most of our offices utilize the 10mm spring. For the 7mm spring, we really made those for 3 different options. So if you have a patient that has a midline that is slightly off, you can choose to utilize that unilaterally to go ahead and move that midline over, or you can do bilaterally, that's absolutely fine. If you have an extraction case, you can use it for that. And last but not least, if you have a patient that has a very petite mouth, you will find that some of our 10mm springs will end up buckling, and that could cause bracket breakage. The next improvement we made was with our hybrid screw. So with our hybrid screw, it is now magnetic and can be utilized with our magnetic Allen pencil. We also added a nylock coating on top, so that's basically going to prevent the screw from backing out or any type of slippage. So the first thing we're going to demonstrate is how to pre-assemble the traditional pivot. Again, these come in both an 0-8 slot size and 0-22 slot size. Our recommended arch wire for the 0-8 slot size is an 18 by 25 stainless steel arch wire. For our 0-22, our recommendation is a 1925 stainless. You do have the option to go 1622, 1725, whatever works best for your practice. As long as it's a rectangular arch wire, we have found that that has worked best. So in doing the pre-assembly for the traditional pivot, we have found that being able to pre-assemble one arch is what works the best. I know right now you can see that they're at different stages, and that's okay. I just wanted to demonstrate that when you do the pre-assembly here, all you have to do is loosen up the actual screw so that you can then safely slide the arch wire into the patient's mouth. Once you get this aligned where it needs to be, then you can go ahead and take your Allen pencil and tighten the screw again. So you can do this on one arch. We have found that doing the pre-assembly and having this go on the posterior area, so whether you're doing a class 2 or a class 3, is the best way to do it so that we can then pull it to the anterior area. So I'm going to show you what that looks like on the arch wire and show you the best way for placement. So once you've got that arch wire slid in, you can see in this case, we're going to be doing a class 2 attachment. So I started in my posterior. Our recommended placement is going to be distal of the 3, mesial of the 6. There are other doctors who have placed these in other areas, especially if you have a more advanced bite. We have had them place it distal of the 2, mesial of the 5, keep it there for about 8 to 16 weeks, and then slide it back distal of the 3, mesial of the 6. So it's really up to you, but for right now, we're just going to show you our recommended placement. And so as you can see, I have this already in the posterior area. Our recommendation on getting this to attach to the next area is going to be with your hemostats. So with your hemostats, you can see I'm right on the square edge of that eyelet. I'm not pulling at the very tip here because we have found that if you try to pull from that area, it will distort the spring and then you won't get the mobility that we talked about by widening that circumference. So once we have this attached, then we're going to pull that up to the actual pivot itself and then we'll do the attachment there. So now that we have the eyelet around on the traditional pivot, we are going to take our magnetic Allen pencil with our magnetic screw and we're going to attach that to the pivot itself so we can complete our class 2 correction. And I will make mention with the nylock coating that we have on there, it's going to cause a little hesitation as you turn. Go ahead and keep turning until it stops. Please don't over tighten. We have found that that will actually wear down the tip of the Allen pencil. So again, once you're done turning, just like so, go ahead and stop. Okay, so the next pivot that we're going to discuss is the pre-assembly of the self-ligating pivot. So with this self-ligating pivot, you will see that it actually has a self-ligating door that we can utilize to clamp onto the arch wire. So this is our 3D model that I'm just giving you a quick demo where we open that door. We're going to place the arch wire in, we're going to clamp it in place, and then we take our hybrid magnetic screw and we tighten that in place. So that's what that's going to look like. We are now going to show you how to pre-assemble. We are going to take our white tip hemostat and we're going to attach that right underneath the pivot itself, just like so. Okay, the reason we want to do that is we want to keep the eyelet facing up so that when we grab our self-ligating tool, we're going to take it and lift it straight up to ensure that the door opens. What we have found are some of the kits will come with a door that is just made so great that it doesn't want to open. So if that happens, contact us right away, let us know so we can send you a replacement. Sometimes we'll get doors that'll be a little bit loose. Those aren't necessarily defective. That just means it's going to be a little bit more challenging when you're trying to place it onto the arch wire. So really, once we lift the door up, we want it to stay up. We're going to add a little bit of pressure with our finger to ensure that it doesn't fall. So once we attach that to the arch wire, it simply is a finger push to clamp that onto the arch wire. So as I just demonstrated on the larger 3D model for the self-ligating pivots, I'm going to take you step by step to see how we get to this final part before attaching it to the arch wire. So as I demonstrated before on the 3D model, we are going to use our self-ligating tool to place in the keyhole, apply a little bit of force, and lift that door. So I'm doing the same exact thing with our actual self-ligating pivot. I went ahead and put my self-ligating tool in the keyhole, and I was able to actually fully open that door. As I mentioned before, I'm applying a slight little pressure to ensure that door will stay open while I'm doing the pre-assembly process. It's not until we actually place it onto the arch wire that I want to hear that snap when I attach it to the arch wire. So we just opened the door by having the placement of the hemostats underneath where the outer pivot exists. Now we're going to have to move it to actually attach the spring and the screw. So you have the option of actually moving those hemostats to the outer edge of the pivot, or you can place the hemostats right underneath the doors of the self-ligating pivots. One thing to remember is that if you take the hemostats and go a little too high, you could end up actually pinching the doors, and then you're not going to be able to close it at all. So pay very close attention to that pre-assembly portion now that we are moving the placement of the hemostats. So, as I just explained on our 3D model, I actually have this attached directly underneath the self-ligating door. Now I'm going to go ahead and attach my spring and the hybrid screw. I always tell everybody, try not to have too many instruments in your hands at one time, because then things just get lost in translation. So what I simply do is I basically just take my thumbnail, I'm going to hold that eyelet in place, and then I'm going to take my magnetic screw with my Allen pencil, and I'm going to attach it. Again, with that nylock coating, you're going to feel just a slight hesitation. Once you get past that point, you'll go ahead and tighten it all the way. Now, one thing I want to make clear is if this ever happens in the patient's mouth where there's no mobility, that just means there's impingement occurring on the eyelid itself. So we want to make sure that we are backing off that screw just a tad so that you've got that mobility, and then we can tighten the screw all the way down. Now that you've seen this done, we're going to repeat that process so that we now have it on the other end. Note, you want to make sure that the screw is facing on both sides, as I have here in my demonstration. Sometimes we have doctors and sometimes staff where they'll have the screw facing out this way and then opposite on the other end. So make sure they're always facing the same direction. Okay, now that we have this pre-assembled, one point I want to make is that in putting this together, I had everybody tighten the screw all the way down. Well, that's great to keep it from falling apart while you have this setting in your kit. The one thing you will need to do in order to attach this to the arch wire is to back that screw off so that there is room for the door to close and attach to the arch wire. So please remember to back that screw off slightly so it can attach to the arch wire. If you feel like you did that and the door still isn't closing, please don't feel like you have to use a Weingart or any instrument to close that down. Just simply back the screw off a little bit more, and then you can attach it to the arch wire. Okay, now that we have everything pre-assembled for our self-ligating pivot, you'll notice that I have my hemostat placed on the edge of the eyelet. This is going to ensure really good placement when you're attaching these to the arch wire. Another thing you'll notice is that I have the keyhole facing gingival. It really doesn't matter if the keyhole is facing gingival or occlusal. You'll just find that assembly and disassembly will be a little bit easier if it's facing gingival, whether it be maxillary or mandibular. So now that I have this ready to place, I am going to place this mesial of the 6. So I'm placing that strictly onto the arch wire here, and then I will go ahead and close that door with my fingertip. And again, once that placement occurs, you're going to hear that click. Okay, so now that we went ahead and attached the posterior section of the Class 2 attachment for the CS self-ligating pivot, we are now going to place it in the anterior area. As you can see, again, I have my hemostats placed on the outer edge of the eyelet for better placement. This also helps hold the door open, as you can see. So when I attach it to my arch wire, it just gives better placement. Okay, so now we're going to talk about the pre-assembly for the twist lock pivot. It is going to be very important that you follow these instructions on perfect placement for the hemostats. So what we want to do, you'll notice there's 3 different areas to the pivot. We don't want to place the hemostat here because this is where we're going to place both the spring and the screw. We definitely don't want to place the hemostats here because what will happen is if we apply too much pressure, we will end up crushing the slot, and that's what we're going to depend on for it to actually attach to the arch wire itself. My recommendation is that you take your wide tip hemostat and you attach it to the very center of the pivot like so. We do want to make sure that it remains parallel when we're doing the attachment. Okay, So here with our actual twist lock pivot, you can see that I have this attached in the center of the pivot itself. So it's not placed in the front, it's not placed in the back, but it's directly center. So I'm going to go ahead and take my fingertip, I'm going to add my spring, and then I'm going to attach my magnetic hybrid screw. Again, you'll be getting past that nylock coating, so you'll feel a little hesitation as you're tightening. Once you get past that point, you'll go ahead and tighten it all the way down, just like so. Okay, now that we have this pre-assembled, one thing that is important to remember is that you need to back the screw off ever so slightly when you are attaching this to the arch wire. If you notice when you try to place the pivot on and it doesn't want to actually attach to the arch wire, that just means that your screw needs to be backed off slightly. So I've already done that in this case. If you notice, I have my math dowels actually parallel with the slot size so that we can actually attach it to the arch wire. So we're going to go ahead and put that on the arch wire itself. Then we're going to turn it towards me, and then that's going to lock it in place. Okay, just as we did on the lower portion, when we pull this up to the anterior, you do again need to make sure that your hemostats are parallel with the slot so that when you attach it, same thing, you will attach it to the arch wire and then you will turn to lock it in place. All right, now we're going to discuss some troubleshooting when it comes to our CS system. So one of the issues is the potential of spring distortion or spring breakage. What we have found is that can typically be occurred either with placement or how it's being attached to the actual pivot. So if you're experiencing any spring distortion, that can typically deal with overstretching that spring. What our recommendation is that we want you to place that distal of the 3, mesial of the 6. We do understand that there are circumstances when you're dealing with an advanced bite that sometimes you can place it distal of the 2, mesial of the 5. You can keep it there for maybe 8 to 16 weeks and then you can move it back to the recommended position of 3 to 6. The distortion will come along if someone's maybe taking a 7mm spring and going distal of the 2, distal of the 6. Sometimes you'll get distortion if you go distal of the 3, distal of the 6. So these are things to look out for. Another reason for this distortion and or the breakage is when you're tightening the eyelet to the actual pivot, if the patient is slightly open, sometimes that can impinge the actual eyelet and that's going to cause it to either break or impinge. Now, talking about spring breakage, we have weight tested our springs to ensure that when that breakage occurs, it will typically occur right underneath where the eyelet is. You'll notice where we have it soldered on the top portion, and then we go ahead and have the rest of the spring. So since these are weight tested, if somebody ends up hyperextending or just moving their jaw in an interesting way and or if there's impingement, we have noticed that it will break right underneath that eyelet. One thing I do like to mention is that our springs are not designed to break in half. That's a safety precaution that we like to take. So again, it's really important that when you're going over the instructions with your patient, that we do want to remind them that we only want them to open 2 fingers width. That is what we recommend. One thing that is important to remember when you're working with the self-ligating pivot is that when you are attaching it to the arch wire, you actually hear that click. If you're not hearing that click, that may mean that your screw is too far in. So all you have to do is simply back that screw off ever so slightly, hear that click when you clamp the door, and another thing you can even do is pull on the spring a little bit before you tighten that screw to ensure that it is fully attached to the arch wire. Once you see that it's attached perfectly, then you can go back and tighten up that screw all the way. With the twist lock pivot, sometimes not everybody has that at a parallel angle when they're then turning it perpendicular to lock it. So you want to just make sure that once you have locked that in place, again, you can simply just tug on that spring itself to ensure that it's fully locked on the arch wire. Once you have felt that, again, you can go ahead and tighten the screw and that should stay in place as is. All right, so next we're going to talk about our hybrid screw. If you've had any issues with it backing out or potentially falling out of the patient's mouth, here's a couple of solutions that we'd like to discuss. Sometimes we've noticed that if our doctors are using a pivot, say an 0-8 slot size, and they like to finish in maybe a 16-22 arch wire, we do possibly run into a risk of it just ever so slightly rocking onto the arch wire. When most of our patients might think that's broke, it's absolutely not broken. It's just a smaller arch wire on a larger slot size. So what's going to be important is when you're tightening that screw that you ensure that that pivot is sitting as buckle as possible, and then tighten the screw there. That's going to prevent it from falling out. Again, if you don't have it buckle and it might be falling occlusal on you and you're trying to attach the screw at an angle, there's no way for the threading to really attach itself, so that too may actually cause it to fall out. The last thing we're going to talk about is our magnetic Allen pencil. The great thing about this being associated with our magnetic hybrid screw is now you have the nylock coating that's on the hybrid screw. So when we're actually tightening our CS system, there's no reason to have to over tighten anymore, correct? So we have the nylock coating that's going to prevent any kind of slippage or allowing that pivot to fall out. So once we get past that nylock coating, you're going to feel a slight resistance, and then once it stops, it stops. There's no reason to ever have to over tighten. What we have found is even though our magnetic Allen pencil is made of 17-4 steel, if you tend to over tighten on a consistent basis, it's going to wear out the little hexagon. So again, once you're done turning, just stop. Awesome. Well, thank you guys so much for joining us for reviewing the components and the overview for our CS system. I hope you enjoyed it. If you have any additional questions or just need additional information, please feel free to check out our website for additional tips and tricks. You can also contact your local territory manager, or you can reach out to me via phone or email, and we'll be happy to assist you either way. Thanks again, and I hope you have a great day.